Yes, travelling up here to Wolverhampton this morning, Kate, you went through areas where they had very high average life expectancy. Here in Wolverhampton, it's a very different picture. It has a lower life expectancy than other areas of the West Midlands, and the West Midlands has a lower life expectancy than many other areas of England. Researchers have included the West and East Midlands in their description of the North for this study, and they've looked at 50 years worth of data to discover that if you live in the North, then you stand a 20% higher chance of dying early. That is younger than 75 than those people who live in the south of England. Amongst people aged 25 to 34, there's a 29% more chance of dying prematurely in the north compared to the south. But this is the one that's really worrying. It's those in their middle ages. People aged 35 to 44. That figure then jumps to a 49% more chance of dying early, under the age of 75. So researchers are boiling down the stats. What they're not doing is offering any real explanation as to why this high street behind me looks pretty much the same as any other north or south in the country. They need to try and work out whether it is all about the economic advantages that people have, perhaps the industrial background that perhaps that they have been working and living in, or perhaps it is, Kate, just social attitudes that lead to these very different outcomes.
Thank you, Richard. Our health editor, Dr. Hillary.
You like that?
Good morning, sir. How are you?
Morning, Jeremy.
Kate said you were an orderly when she met you, but I wouldn't be so rude.
I think he just put a white coat on and walked into TVM and no one's ever challenged him. That's always been my theory. It's not true. You're a huge authority, a huge authority.
Can I just, because we just had this given to us by our producer, and there's this story this morning, this 20%, this north-south divide in terms of death. Before we get into the medical, I just want to throw this out here, if it's all right with you. There is more government funding per head, this is factual, more government funding per head in the northeast and the northwest than there is in the southeast and the southwest, although London, as a separate entity, gets more. How then do we end up with these figures?
Well, it's probably about time. It probably hasn't been done for the last 20 years, so we're trying to catch up. And there's no doubt that we need more infrastructure, more jobs, more economic security, more education in the north than we've already got in the south. I think the north has been neglected after deindustrialisation many years ago. We didn't have this inequality in wealth and health in the 50s, 60s and 70s, but we've certainly got it from the mid-90s onwards. And in the last 20 years, the number of people dying prematurely in the north, 20% higher than in the south. And if you look at the young, the age group 24 to 45, the discrepancy is enormous. It's 49% higher premature death rate, which is terrible.
From a health point of view, based on what? Layman's terms?
Well, we're talking about things like self-harming, talking about suicides, we're talking about smoking-related deaths, alcohol-related cirrhosis, car accidents, you name it, across the board, there are many, many more deaths as a result of these things in young people.
Particularly in the north, if you're saying the root cause is a long-term poverty gap. I mean, why does poverty necessarily lead to self-harm?
It leads to unhealthier lifestyles. And if people have no hope, if they're despairing, they look for escapist behaviour, and that escapist behaviour may be smoking excessively, it may be drinking to excess, it may be indulging in dangerous behaviours, drug taking, and then poisoning and accidental drug deaths. So we don't know from the data, from the data on which this report was collated at the University of Manchester, what the causes of deaths were. But if we look at individual regions, we can tell what those stays in hospital are due to and the deaths are due to. And it's largely those things which are largely preventable. But we must have much more investment up north. Yes, we've got it now, but we're lagging behind.
Just a quick question, Hillary, to finish. Is it investment or is it education?
It's both. We need more building. I mean, even since Dickensian times, we knew instinctively that if you've got poverty and poor housing and disease, you're going to get a premature death rate in the poor compared to the wealthy. And we've still got that to some extent. We know the causes, we just have to address it. It does mean education, but it also means building and jobs and hope and all those things put together.
Fantastic, thank you. Health editor.
Yeah, interesting, isn't it? Because whenever I visit family up north, I always feel everything's very thriving. It must just take a long lag time, mustn't it?
I think so.
And of course, things to filter through.
And it's even patchy in places like Wolverhampton.
Of course.
I was going to say,
in Wolverhampton, there's an 8% difference.
I think it's a bit dangerous to say north and south. The Midlands are a massive area as well.
There are patches of wealth up there too.
Thank you very much indeed.